Okay, we're good.
Okay. Hey, I just want to take a quick minute to first apologize for this buzzing. We're working on that. But hey, just to welcome everyone out tonight to this night's She Talks. Our event tonight, we came up with a really original title, Women's Healthcare in Challenging Times. And we have just a great two experts here to talk to us. But before we introduce them, I just want to talk to you guys a little about AFW. AFW, Arizona Foundation for Women, where our offices are located here in this building. Our mission really is to advance the status of women through research, advocacy, and philanthropy. Say it for me. Yeah, give money away. We do that in a lot of different ways. But one of the things that we do that can be very interesting is a series, like basically a lecture series, one of which is tonight. We call it She Talks, sort of styled after TED Talks, short, informative, experts. You guys can ask questions. We just ask you wait until the end, and then we can take questions and we can talk about it. I did want to tell everyone that we are videotaping this. We post these online, so if you get questions, remember to repeat the questions, because if you get a question, try to repeat the question so that we can get that on camera. I want to thank everyone who's helped out tonight. I just want to recognize the board members. I know we have a few board members here tonight. Raise your hands. Okay, so you see a couple people raising their hands. Make sure that before you go, you've spoken to, spent some time with a board member. We like to get to know different people that are here. Everyone have a raffle ticket. Okay, are these not? These are good odds. Okay? So these are good odds. We even had someone came back this week, promised that if she won again, I'm going with her. So
No one.
I'm not going to be able to pull that out. Okay, cell phones, make sure those are off as we get started. The bathroom. If you need to use the bathroom, you don't have to raise your hand. You can get up, go. Just go right out that door. Follow it around to the right. Keep going right until you see the bathroom on the left.
And don't walk in front of the camera.
Yeah, please don't walk in front of the camera. It's really, guys, everyone, it's really an honor for me. I've been a board member for 3 years. Yes, Carol. Thank you. My name is John Elison. I'm a board member of the Arizona Foundation for Women. I've been on the board for about 3 years. In my day job, I'm a prosecutor with the Maricopa County Attorney's Office. And for a long time, I've supervised and ran our special victims unit, cases involving domestic violence and sexual assault. Got a different assignment, but we still have too many women that are victims of violent crime. And so I love being involved here because we get to I get to see ways that we can help women other than prosecuting the people that killed them or beat them. So it's a pleasure to be here. It's a great organization. If you want to know more about it, again, see some of the board members. But one of the best things about being involved in this board is the time that they get to spend with so many smart people. Okay? They care about issues that I know are important to everyone here. And so it's a great board. With that, I want to introduce Dr. Belinda Barclay, who's going to come up and introduce our speakers. Belinda?
So, thank you all for coming. Unfortunately, we hit May month, which is graduation and school holidays, and our numbers are a little bit down, but we're really happy you're here. It's very informal and easy sort of venue, okay? I dare say that most of us in this room grew up in a family situation, a supported family, maybe with access to medical care because we have medical insurance through our pediatricians, our family practitioners, and as adolescents, very quickly, our OBGYNs. And our OBGYNs are a hugely important part of women's health, obviously. And I'm so happy to be able to ask Julie Quattro, who I've known for years. She's been a OBGYN in Scottsdale. She comes originally from Albuquerque, New Mexico. She has an undergraduate degree from Duke University. She then attended the Ohio State University College of Medicine. I probably shouldn't talk about football teams right now, right?
Yes, you should.
Actually, are there even football teams?
Blue Devils?
Yeah.
Not a good one, though. Basketball.
Basketball, there you go. See, I'm not the person to be talking about that. The Ohio weather drove Dr. Quattro straight back to the Southwest, though, where she trained in obstetrics and gynecology with the combined program here in Phoenix, and she's been in private practice ever since. She's an extremely well-respected gynecologist who I've shared many patients with, and I'm so happy that she agreed to talk to us tonight. Dr. Quattro has always been fascinated with the politics and public policy of women's health care, and in that vein, she has served on the board of the Arizona Coalition on Adolescent Pregnancy and Parenting, as well as the board of Planned Parenthood Arizona. For the past 4 years, she has served as the legislative chairwoman for the Arizona section of the American College of Obstetricians and Gynecologists, where she acts as the liaison from the OBGYN community to our state legislature. I would like to introduce you afterwards, but maybe you're going to talk together.
Yeah.
So, Jody Liggett, JD, most recently served as a senior policy advisor for Phoenix Mayor Greg Stanton, where she was instrumental in one of Phoenix's significant achievements, the passage of Phoenix's equal pay ordinance for women. She has a continuing role in Phoenix as chair of the Phoenix Women's Commission. She is the former CEO of Arizona Foundation for Women. She authored 2 of the Status for Women reports that you see here on the desk. And she has served as a senior policy advisor to Arizona Governor Jane D. Hull and as legislative staff in the Arizona House. She's a graduate of the Sarnia Day and Connor College of Law. And
Sundance.
She's Vice President for Public Affairs for Planned Parenthood Arizona, where she oversees reproductive health and rights policy objectives, supervises litigation, and manages the work of Planned Parenthood Advocates of Arizona, the separate organization that educates voters and candidates for public office. So with that, I will turn it over to these lovely ladies.
Thank you for coming. Thank you for having me. Thank you for having Jody. It's really an honor to be here. And I want to thank Dr. Barclay White for inviting me, as well as Jody, who told me about the Arizona Foundation for Women and invited me here today. I really, really appreciate it. As Dr. Barclay White said, my day job is I'm an OBGYN. I've been in practice in North Scottsdale for 17 years. But I've always been interested in politics and the public policy of women's health care. And I've been lucky to have a front seat to the policy of women's health care in Arizona and nationally, both being on the board of Planned Parenthood, as well as being active in my national college, which is ACOG. We're very politically involved. And so my current job is to sort of be the advocate for board-certified OBGYNs in all of Arizona and to be the voice of the legislature. We want to advocate for good laws and oppose bad laws. As Jody will tell you, mostly we're opposing bad laws, and mostly we don't win a lot of the time, but we're still chipping away at it, and we've made some inroads in the last few years. But I had not heard about the Arizona Foundation for Women. So when Jody told me about this, I Googled it and got on your website, and my first thought was that this is perfect. Like, this is a perfect venue to talk about reproductive health care, because your goals as a foundation, which is the health, safety, and economic empowerment of women, I would like to argue that the linchpin of all of those things have to do with women's access to reproductive health care. Family planning, without it, you can have none of those things, health or safety or economic empowerment. So I'm going to make that argument, and then I want to talk about where we are with reproductive health care, both nationally and in Arizona. I like to call it the good, the bad, and the ugly. There's a whole lot of all 3 of those. We're going to start with the good. And then I just want to say, this is casual. I love that. Please feel free to interrupt me and ask a question. Jody, also feel free to interject. I'm going to include her a lot after the beginning, because she is really a wealth of information about where we are with reproductive health care, because there's always a lot going on. So people ask, obviously it's sort of important intuitively why reproductive health care is important, but there's a lot of research and a lot of history and a lot of stats to back that up. And the CDC calls family planning one of the great health achievements of the 20th century, one of the top 10 health achievements is family planning. So they rated along with like motor vehicle, decrease in motor vehicle deaths as well as vaccinations. And everyone agrees that family planning is important no matter what side of the political divide you're on. Everyone thinks women need to be able to plan their family size, the timing of their pregnancy, the spacing of their pregnancies, and this leads to huge improvements in economic and social well-being. And that seems obvious. So I always say, like, this really is not a women's issue. It's a family issue, but it's also a societal issue, and it really is, to me, a human rights issue in many ways as well. And family planning in developing countries literally saves lives. It's life or death issue. So the goal of family planning and reproductive health is fourfold. But the big one is, of course, avoiding unintended pregnancies, because those have huge costs to women and society. The other one is sexual education, which is very important. You can't really avoid unintended pregnancies without contraceptive education, as well as contraceptive access. Screening and treatment for sexually transmitted infections, but it also includes things like abortion care and also screening for domestic violence as well. All those things sort of roll together. So let's start with one of the first pillars of the foundation, which is the health of women. Family planning is critical to women's health, as well as children's health as well. Women who have unintended pregnancy have a very high increased death of maternal death and complications. Teens especially, which is a target group, with a high rate of unintended pregnancies, they have a 2.5 increase in their mortality rate with these pregnancies when they're not planned. In the obstetrics realm, we see things like late prenatal care, poor weight gain, a higher rate of pregnancy complications in women who are not planning their pregnancies. It leads to increased depression and increased domestic violence and economic hardship and more poverty. So one of the things that we know that gets women out of the cycle of poverty is to make sure that they have access to reproductive care. Children of women who have unintended pregnancies also have adverse outcomes, and it makes sense. But they have a higher rate of low birth weight, prematurity, social and behavioral problems, higher infant mortality. They have access to less resources and a higher rate of child abuse. So there's a whole lot of other social problems that come along when women don't have access to the reproductive care that they need. So in a nutshell, it seems obvious, the family planning improves maternal and child health. There's better economic and social satisfaction, and there's more economic and social opportunities. And that said, that all sounds great, and it's true, and we all agree on that, except that 45% of the pregnancies in the United States are unintended. So we're not doing the job that we should. I mean, that's almost half, the vast majority of which are paid for by your tax dollars, by federal and state money pays for the vast majority of unintended pregnancies in the United States. So these are issues with a lot of resonance in many realms. Hitting on the second pillar of the Arizona Foundation is the issue of safety. And people say, like, what do reproductive health care have to do with safety? It's sort of a strange synergistic relationship. We know that 4 million women can endure violence in the United States, with up to a 45% saying that they have been raped. That's probably underreported. A lot of women in abusive relationships need contraception but can't get access to it because there's something called reproductive coercion, where their partners will stop them from accessing birth control. Because a lot of women are forced to stay in abusive relationships because they have a dependent child or because they're financially dependent. So many of these women have trouble accessing birth control and they need it, but yet contraception is one of the tools that may help them get out of an abusive relationship. And one of the big deal with Planned Parenthood is screening for domestic violence, I know, is a big pillar in family planning clinics, because there is such a high rate of domestic violence in all populations, but in a vulnerable population as well. For women in abusive relationships, they're 3 to 5 times more likely to become pregnant. That's for a lot of different reasons. Especially teens, they may fear negotiating things like condom use if they're in a controlling relationship. And that teen moms who experience abuse within 3 months of delivery are twice as likely to have a repeat pregnancy within 24 months. So that's really a population that we need to think about with reproductive health care. We again know that domestic violence is actually a barrier to contraceptive use, but birth control actually can be a tool for them to get out of a domestic violence relationship. So the last pillar, economic empowerment, is critical, it's obvious, it's huge. Unintended pregnancies cost U.S. taxpayers $21 billion every single year. Again, the vast majority of unintended pregnancies are paid for by Access and Medicaid. Obviously, an unintended pregnancy can undermine a woman's chance to get an education, to have a career, to plan her family, to get out of poverty, to keep a job. And that investments in family planning, which we're going to talk about, that don't cost much, can save taxpayers $15 billion and saves 760,000 abortions every year. Again, it makes sense. Family planning decreases abortion rate. It's good on every level. But at the end of the day, there is no economic empowerment for women without family planning. They go together, they're part and parcel with each other. To support one, you've got to support the other. So feel free to interject here, but I always like to talk about my favorite family planning success story, which is the Colorado experiment many of you may know about. It was a grant given to the state of Colorado by Warren Buffett's late wife, who was very big into family planning. And it started, I want to say, around 2009. And for 6 years, long-acting reversible contraceptives that we call LARCs, so things like IUDs and the contraceptive implant, which goes in women's arms and is very excellent contraception for 3 years. Those things were given free to women, especially women in rural areas, which really struggle to access contraception, as well as poor women. And they wanted to see, hey, if you offered free birth control to women who might not have a chance to get it, would they take it? And they did in a really big way. And the statistics were shocking. Within a very short period of time, I want to say within the first 2 or 3 years, the teen birth rate was down 40%, the abortion rate was down 42%, and that every dollar spent on this program saved $5.85 in Medicaid, and the state saved huge money, both in Medicaid dollars. They saved millions of dollars, which makes sense, not having to support these pregnant women as well as children that got on Medicaid once they were born. And their WIC budget went down by 25%. So it was an astounding success. It makes sense that they should initiate this nationally. And I just remember that we talked about this at one of the ACOG meetings. The grant ran out, and the state of Colorado just had to fund the grant, fund the program again. It was like less than 1% of the state budget, and they initially didn't do it. Just due to the political winds of the day, that they thought IUDs caused abortion, and there was a lot of people that were opposed to it. I think they eventually did fund that grant, but it took a couple of years. Even with the numbers, you know, it was good for everybody. It was good for women. It was good for children. It was good for taxpayers. It's good for everybody. So that's the kind of model that we can use to know that family planning is critical to women's health and how important it is to our economy. So that just sort of brings us to where we are today. I want Jody to feel free to interject here about the state of women's health care in the United States, both on the national level and where we are in Arizona. And again, I like to call it the good, the bad, and the ugly. So we're going to start with the good. We'll segue into the bad. We'll certainly segue into the ugly and just talk about what we spend a lot of our times doing is to advocate for good policies in women's health and sort of fight these bad laws that are going through many legislatures, but especially ours, unfortunately.
On that note, so I'll interject now and give you the thumbnail 100-year history of Planned Parenthood in hopefully 30 seconds or less.
Take your time.
But oh no, right? It's just so leading into this advocacy discussion, I think it's helpful for people to understand. So you've heard us talk about like reproductive health care and women's health. I think in today's environment, people tend to assume that that's like all a euphemism for abortion. We're really talking about the full spectrum of women's health care and a huge emphasis on contraception and family planning.
Education.
Yeah, about prevention. And Margaret Sanger, our founder, was about prevention. She observed all the things that Julie just talked about. Right, impact on safety and health, and especially women and children's economic well-being. So Margaret Sanger was born in 1879. Her mother had 11 children, and those repeated pregnancies, one after the other, and very poor family, led to her mother's death at age 50. And this just made a huge impression on Margaret Sanger. You know, they lived in Greenwich Village, which is trendy today. It was a horrible slum around the turn of the last century. So Margaret Sanger, as a nurse, she just saw woman after woman after woman sickening, weakening, and dying because of this unending string of pregnancies. There was no access to birth control of any scale. So she had information, and it was crude back in the day, but she had information and advice and opened up a clinic to help women access that. Now, flash forward to the current day. A lot of people ask Planned Parenthood, like, guys, why are you so out there? You know, why are you so political? Why are you always talking? And now you're going to understand why. Margaret Sanger opened the first clinic in New York in 1916. 10 days later, she was thrown in jail for doing that. So for 10 days, we were a completely apolitical organization, right? And political is really not the word. Advocacy is not the same thing as getting political and trying to impact elections. Advocacy is about working with people from all parties to construct reasonable public policies that benefit the most number of people that we can. And that's where our head is at, certainly. So she did eventually get out of jail. 5 years later, she formed the Birth Control League. And remember, birth control is illegal. The pill which Margaret Sanger funded the research for and found the researcher, we were heavily involved in the development of the pill. The FDA approved that in 1960, but contraception was still illegal in most of the country. In fact, the case Griswold versus Connecticut, Estelle Griswold was the Connecticut Planned Parenthood director, and that lawsuit was about married couples being legally able to use birth control. So just, you know, I was born in 1966. This wasn't that long ago, right?
It went to the Supreme Court.
Right, it went all the way to the Supreme Court. Like, that's when contraception became legal in this country in 1965. I think it helps to remember that, right? And that's really our major emphasis here, is on the prevention side. If you hate abortion, frankly, you should love Planned Parenthood, because we're the nation's largest provider of contraception. Like, that's what we spend most of our time, effort, and money doing, is trying to prevent unplanned pregnancies, and we think that's something that the American people agree on. So thank you for my little brief commercial and history on Planned Parenthood, and then we'll tag team on the rest of the stuff here.
So, talking about sort of where we are, I want to go back a few years and say that we have gone through some very good times in the last several years with the huge advancements in access to reproductive health in this country. And that really is the Affordable Care Act, which people have huge opinions about, and certainly my specialty has huge opinions about, good and bad. It's ragingly controversial in some quarters. And the American College of OBGYNs was initially opposed to the National ACOG, was opposed to the ACA when it was kind of getting legislated during the sausage-making process in Congress, because everyone was terrified of socialized medicine, and because ACOG thought the ACA was not going to meet the needs of its physician members. But ACOG, being the political powerhouse that it is, I'm very proud to belong to that organization, along with partnering with Planned Parenthood, along with partnering with the American Medical Association and other diverse groups, got so much good women's health legislation legislated into that law that it was literally the most important advance in women's health policy since 1965. So that tells you that this was 2010, we were probably due for an upgrade in women's health access and availability. What basically was the story was that women have been discriminated against in healthcare for a very long time. And in 2010, 20% of women under the age of 65 were uninsured. For various reasons, it was too expensive. They had a pre-existing condition. Insurers, of course, their goal is to make money, so they have a different agenda, and Dr. Barclay White and I both struggle with this every day, is that insurers, it is a fact that women use the healthcare system more than men, mostly because in their lifetime they are overwhelmingly going to have a pregnancy and need to interact with the healthcare system. So there was a lot of discrimination where women had to pay more than men for the same coverage. A lot of insurance plans didn't include maternity coverage. If you were a domestic violence victim, you had a hard time getting insurance if that was ever reported because you were considered a high-risk person. So what the ACA did was legislate all those things out. And it increased access to affordable insurance. And in 2016 alone, 6.8 million women were able to get, more women were able to get insurance than before. Some of the big things it did for women was make all plans be able to cover maternity care. I remember when for the longest time in practice, again, 45% of pregnancies in the United States are not planned. So it really makes sense to have insurance plans that don't cover maternity for all those unplanned pregnancies. And I would have patients that were paying a lot of money for a very good insurance plan that didn't cover maternity. They would have an unplanned pregnancy and then they were paying cash out of pocket or have to get on access for their maternity care. I mean, it was ridiculous. More importantly, there was access to preventative services that women need at no cost. A pap smear, a mammogram, other preventative care, breastfeeding support, and most importantly, no-cost birth control. So there was a less discrimination, and the results were exactly as we thought they would be, similar to the results in Colorado, where the teen pregnancy plunged, the abortion rate went down, Medicaid dollars were saved. So especially in states that expanded Medicaid, of which Arizona was one of them, and that was an excellent thing that Arizona did, our teen pregnancy went from 6th in the nation to 12th in the nation once we expanded Medicaid. The abortion rate went down. So those successes were replicated in Arizona as well. Again, less preterm delivery, increased contraceptive use, decreased abortion rates. And there was a 33% reduction in the uninsured rate in Arizona. The big issue is that, again, women in Arizona had access to forms of contraception they previously did not have access to. And the reason why is those long-acting contraceptives are extraordinarily expensive. An IUD is $900. That implant is $900. So even if you have a copay, the copay may be a few $100s based on your insurance. That was prohibitive. Making no-cost birth control gave women access to these contraceptives that they wanted. So that was kind of the bright spot for reproductive health. And don't forget, the birth control thing was controversial. This was litigated. It was still being litigated.
It's still
It went to the Supreme Court 1 or 2 times for different cases. They had to make exemptions. I mean, really, they had to fight for these very basic women's health care coverage, basically just to decrease the discrimination in the insurance industry, but also to expand Medicaid so more women had access to health care, and that's what it did. So getting to the bad is that where we are now, and this even started before the last election, is that women's health care is under assault, and it's really under assault. We're not just saying that, it's bad. And it's bad on multiple different levels, and I like to think of it as sort of bleeding from 1,000 cuts. It's not just one area, it's like 5 or 6 major areas where women can access health care. And again, what we're gonna see is a reverse in these positive trends. If women's health care is impaired, if reproductive access is impaired, we are going to see more abortions. We are going to see more unintended pregnancy. We are gonna see higher costs to taxpayers and worse outcomes for moms and babies. And so where we need to be, as I talked to Jody, is not asleep at the wheel. Because when we were asleep at the wheel, a lot of bad laws were going through that no one was paying attention to, except maybe Planned Parenthood, because they've never been asleep at the wheel, to help stop these laws. And so I want to talk about where the attacks are coming from. And we can talk about at the federal level as well as what happens in Arizona. And of course, we're happy to field any questions about these things as well. So the first thing I want to talk about, and Jody can fill in the gaps too, is attack on Medicaid. So that's the first thing. So what do you see is happening at a federal level?
So there is definitely an effort to exclude abortion providers, namely Planned Parenthood, from the Medicaid program, kind of by hook or by crook. So there's activity in Congress to do that, and then there's been activity at the state level to do that. And that means anybody, that's not about, you know, Medicaid paying for abortions. It doesn't.
That's actually using
already.
birth control.
In very rare circumstances does Medicaid ever pay for an abortion under federal law. So that's not what we're talking about. We're talking about anybody out there who's, like in Arizona, on access, just being able to come to Planned Parenthood as their doctor because they want to, because they want to get their pap smear from us, because they want to get their breast exams from us, or their STD testing, or their annual exam from us. It's really, that is a political move. That's about trying to punish one institution for a lot of reasons. So I want to navigate that a little bit. But what that does is dramatically impact poor people's ability to access health care. It's not like there's a community health center on every corner, especially in Arizona. So the neighborhoods we're in, we are the only healthcare provider in that neighborhood. I'm thinking of our Maryville clinic that serves tens of thousands of families, and there is just nothing around for miles, especially for an immigrant or a neighborhood that has a high population of immigrants. Planned Parenthood, you can come, we don't ask you if you're a citizen, we just provide you health care. So when you take a major funding stream like Medicaid, or we'll talk about Title X in a minute, that's a federal family planning program. If you remove that source of revenue from anywhere, it's going to be really hard for that institution to survive. And we're going to have a big problem in our country if we put the nation's largest provider of contraception and family planning out of business. I mean, that would be a dramatic move for our country, and the immediate result would be that unplanned pregnancies and abortions would go up.
The other thing is that there are other attacks on Medicaid, not just from a family planning perspective,
Sure.
but for instance in Arizona and in other states, and you've probably been hearing about this in the news, where they want to make work requirements for Medicaid. Basically, they don't like Medicaid, they don't like having to pay for vulnerable people's health care. Even though it's actually a very popular program nationally, our legislature doesn't like it, and they're trying to nibble away at it. And so with those things like work requirements or other requirements, a lot of people are going to be uninsured again, basically, are going to fall off the grid. And so again, so much of this is just being insured, having access to health care. And that is still not a panacea, because there's a lot of walls of people accessing health care. And trying to break down those walls is a complex thing to do. There's people that had got insurance, but they never went to the doctor, they didn't know what to do with it, or they didn't know what their benefits are. So there's other complex issues, but kicking people off insurance is one of the first ways we are going to increase unintended pregnancies and decrease people on Medicaid. So nationally, and in the state of Arizona, they want to roll back the birth control benefit of the ACA. That's currently under attack. The current administration, one of the first things that was done was to say that insurances didn't have to cover birth control, and almost immediately, even though the ACA was still in effect, I saw that in my practice. So I can say that after the election, there was a big run on IUDs.
Oh my gosh.
It was crazy.
Our clinic was flooded.
It was, people.
There were news stories on this.
I
You
did
might have
not
seen it.
realize how many people were into the news and knew what was going on and thought it would affect them personally, because I saw a huge run on IUDs in the first several months after the election. And then all of a sudden we realized, like, my patients weren't able to get IUDs anymore. And these are patients, I mostly have a private practice in Scottsdale of private insurance. We don't take Access, we don't take Medicare. And all of a sudden IUDs were not accessible anymore. Because even though the ACA was still in effect in Arizona, no one was holding insurance's feet to the fire. The minute you don't hold them to the fire, believe me, they will do anything they can not to provide health care to improve their bottom line. So IUDs all of a sudden were prohibitively expensive, or had a copay, or they just were too difficult with bureaucratic issues. So our IUDs sat in the closet for a long time. It does seem to be better lately. I don't know why, but I'm seeing an improvement in coverage. But there was a good year there that our decrease in LARCs went down. So the birth control mandate is under attack. In Arizona, it is under attack. I believe that our legislature does support rolling back the birth control mandate. We do have some legislators that we're trying to help, we're trying to encourage them to introduce legislation to at least keep the birth control mandate in Arizona, to say that insurers in Arizona have to do no cost or affordable birth control. But with the current makeup of our legislature, I don't know that that's going to go anywhere. Although I do think that most of our legislature supports birth control, but for various different political reasons, they don't want a law to protect it. So rollback in birth control, attacks on the ACA, attacks on Medicaid are huge. And that sort of brings us to Title X. Does everyone know what Title X is? Has anyone heard of that? Okay. It's funny that it really impacts millions of Americans. So Title X is a program started by Richard Nixon in 1970. And it is it sort of was it started with Lyndon Johnson's War on Poverty. Everyone agreed that family planning was essential to economic empowerment and for better health outcomes for women and children and families. Everyone agrees on that. But the federal government felt that it needed to do more for family planning. So these are family planning dollars from the federal government that go to fund family planning clinics in various states. And I have my Title X sheet here. It's been a very successful program, obviously, for over 40 years. And in Arizona, all of the Title X money goes to a grantee called the Arizona Family Health Partnership. And what the Arizona Family Health Partnership does is give these federal family planning dollars to clinics that do family planning. So there are some clinics that are just Title X clinics that they do family planning that is basically for poor and underserved people. People that can't afford birth control can get it almost free at a Title X clinic. And there's, I forget how many clinics in Arizona, there's probably at least 10.
At least 10, yeah.
At least 10.
We
And
have
the
a
stats are that in
dedicated
Arizona, the Arizona Family Health Partnership, basically Title X dollars, serves 36,000 men, women, and teens every year by providing birth control, accurate sexual education and counseling, sexually transmitted disease screening and treatment, breast and cervical cancer treatments, they must do mammograms there as well, pregnancy counseling. The average client is actually 28 years old, so it's not like they're serving just teens, basically poor and rural women that struggle with access. They prevented an estimated 7,000 pregnancies in 2016 in Arizona and prevented at least 2,400 abortions and saved the Arizona taxpayers at least $61 million. So Title X funds are huge and an important source of family planning, but not even most of my colleagues have heard of it, which is kind of funny. Title X is under attack and has been under attack. It has been under attack by people that are anti-choice, so I don't know why abortion just keeps bleeding into the conversation, but basically people who are opposed to pregnancy termination don't like Title X because several Planned Parenthood clinics get Title X funds for family planning.
Right.
No Title
Not
X funds go to abortion, it's
Right.
illegal. There was an amendment that prevented that. So Title X has been under attack, and it's really under attack in this administration, unfortunately, because the people that administer the program are actually anti-contraception. That seems to be a trend that people who run their departments are actually against what their department is for. I've seen a lot of that. I don't get it, especially something as economically important as family planning. So what we see is a bunch of laws going through legislatures that basically, so first they're just trying to cut Title X. They're trying to cut the budget of Title X. That's the first cut. The second cut is that a lot of laws, in fact, they passed one here right now that's kind of in progress. We're trying to see where that good plays out, where no Planned Parenthood clinic can be a recipient of Title X funds. And what that's going to do is shut down certain Planned Parenthood clinics, and then that's going to shut down a lot of access to family planning. So Title X is a huge issue. I don't know if you want
And
to
I'll
add
just
anything to
jump
that.
in. I think, you know, if you're talking to your friends or your family members or policymakers, which I highly recommend, you know, it's almost like as a country we've gotten down the completely wrong track on some of these issues where people are worried about someone somehow getting something for free, right? That is the mindset, so you want to cut programs because you don't want people to have something for free versus having a public health perspective, right? We don't want kids to have cavities, we put fluoride in the water. We don't worry about families getting a cavity